Hi, welcome everybody. It's me, Dr. Khaled Sadek, and you've tuned in for one of my virtual global clinics. Now, for those of you who are familiar with the channel, welcome. For those who aren't, I'm Dr. Khaled Sadek and I specialize in the treatment of cysts and lipomas, amongst other things. So I've dedicated my YouTube channel to showcasing the work behind cyst and lipoma treatment, try and debunk the myths and encourage patients to reach out and get treatment promptly. Remember, if you've got anything and you'd like treatment, then lipomacyst.com is your one-stop shop for all skin complaints. You can also find information on drkhaledsadek.com. If you don't know already, I'm on Facebook, Instagram and Twitter, and if you're new to the channel, would love for you to subscribe, so please press the subscribe button. Also, if you're already subscribed, don't forget to hit the notifications button, because if you do that, you'll be getting notifications for when we upload our videos. Now, every Wednesday, Friday and Sunday is Global Virtual Clinic Day, where we meet our friends from all over the world. We discuss health topics. If you've got any questions about any medical conditions you aren't answered, then please put it in the comments. If you want to say hello to your friends and your family, then please do so in the comments as well. After the live chat, we'll go to our premiere and we'll be releasing our brand new video for this evening. Hope you enjoyed the last clip. It was quite an unusual cyst. It was right on the abdomen, right in the tummy, near the belly button. So if you haven't seen that, make sure you go check it. It's got a bit of an age restriction on it, so you'll have to log on to YouTube to see the full clip. So, with no further ado, let's crack on. Let's say hello to everybody. So let's scroll up to the very top. Let's see who we have in the house. So we like to do this every live session. We like to put our first three comments on podiums. In at number 3, we've got let's look. We've got Louise Cook. Louise Cook, welcome. In at number 2 is Bridget Schumacher. But today's podium position, today's number 1 position for the commenting is Sherry. Welcome, Sherry. Let me move the lighting a little bit closer so that you can see me a little bit better. Well, there we go. What causes diabetes, how to manage diabetes, and medication relating to diabetes and complications as a result of high blood sugar. So if you've got any medical conditions, don't forget to put in the comment section. Thank you for everybody who's been frivolous and bought some of our merchandise, gimmicky merchandise, mugs, pillows, and a fun mask. Remember, all proceeds go to cancer research. So let's put those away. Now, let's continue with our meet and greet. Who do we have in? Bridget, welcome. Louise Cook, welcome. Sherry S, welcome. I'm guessing you have to log in at 4 p.m. in order to be the first. That's maybe. Gail, welcome. Christiana from Windy London, welcome. Sid G, hope everybody's having a great Friday. I hope everybody's having a wonderful Friday. Question, have you ever removed a botfly? I think we call them here ticks. Botflies, I guess they're the kind of same kind of thing. Yeah, we have. When I was junior, we used to work in emergency departments, and they would come in latched onto people's ankles. So yeah, absolutely, we did. And obviously you've got to look out for Lyme's disease, which is the sporidium infection that is a result of the botfly or tick bite, and you get tick bite encephalitis and chronic fatigue. And those patients suspected of tick bites should be started on antibiotics, typically doxycycline, extended course, 21 days. Let's have a look. Good question. I like it. Off-piste. Denise from Edmonds, Washington. Welcome. Finally getting some rain, and it's muggy. I think everybody around the world is getting a bit of rain now. Dr. Sarah, our orthodontist, is in the house. Laura McLean from North Carolina. Caroline TomTom. Hello, how are you doing? Welcome. Laura Pulsfa from Utah. Welcome. From Hungary, we've got Anna Marco. It's 9:33 in Hungary. Welcome. Anna, whereabouts in Hungary are you? Let me know. Is there a big popaholic community in Hungary? Let me know. Really intrigued. From Richmond, is Michelle McDonald. Welcome, Michelle. Patterson from Nova Scotia. She's loving the educational videos. In the next clip, we don't have audio. In the next clip, I forgot to mention, by the way, we've got 2 cysts. Not 1, but 2. So 2 cysts in one video. It's this one gentleman, he's got 2 cysts. And the first half is narration. The second half is audio. So you got a bit of narration and audio. Let me know what you prefer. We've got 2 pops though. 2 pops for the price of 1. Cannot complain. Mary Wolf, good evening from a very warm Netherlands. Mary, where in the Netherlands are you? Are you in Amsterdam? Are you in Rotterdam? Let me know. Are you in Bruges? Sherry, hi. LL, hello, how are you doing? Margaret Brace from Lake Erie, welcome. Daniel Bruta from Romania. Hello, Daniel, welcome. Welcome. Sandra Goody, good evening from Enfield in England. Hope your weekend is going well. Was it windy today? Yes, it was. Very, very windy, which has been a change from the last week where it was 36 degrees and absolutely stale air. No wind at all. Now we've got a bit of wind. It's nice to have a bit of breeze. Lisa Kelly, greetings from Vancouver. Welcome, Vancouver. Jean Norbury, welcome. Welcome. She is enjoying the show. She sends her greetings. Good luck from Daniel. Thank you, Daniel. Thank you so much. Lisa Kelly, what's your skincare line for 68-year-olds? Yeah, I mean, yeah, it's interesting. We should do a skin line. Certainly, we're going to do a aging video, aging cream, anti-wrinkle cream, that kind of thing. So we'll definitely be doing that. We'll stay tuned. Once I get a bit of time, I'll edit that video. Margarita from Portugal, welcome. Hola, doctor. Bom trabalho. Todas Portuguese admiram. Felicicadas. Welcome. I think I kind of worked that out. I'm not sure if I read it correctly, but wonderful. Portugal. Whereabouts? Lisbon, Madeira, the Algarves. Margarita, where are you from? Marion, welcome from Scotland. She's sending her greetings from Scotland, where I think the British Prime Minister is vacating. Welcome. Lisa Kelly, where can I find your merchandise? It's a Teespring. I think if you go to any of the videos, it should appear on the banner at the base. And there's a lot. Welcome. She's loving the Global Clinic from the United Kingdom. Simply the best. Tina Turner reference. I like it, Sulalali. Jay Corwin from Cape Town in South Africa. Welcome. Welcome. Sandra Goody from Enfield. I really want your scrubs. When can we have the scrubs? Soon. I'll probably put these on the Lipoma Cyst website, not on Teespring. So once we get some printed, we'll have it. We'll have it printed. Dr. Khaled. How do you want it to say? Do you want to say like Dr. Khaled Sadek on there, or do you want to say Lipoma Cyst? Let me know what you want it printed, and we'll do that. And let me know the sizes. Let me know the sizes. Helen Cole from South Carolina, from the Appalachian Mountains. We had torrential downpour. And I'd send it to California if she could. Okay, wonderful. Laura Pulsfer, I wish I lived near you. You could take care of my skin. At least Laura, that's so kind. Too kind. Sunalali, hello, Dr. Sarah from the United Kingdom. Many thanks for your medical help. Wonderful, wonderful. She's been helping her daughter. Laura James from Kentucky. Welcome, welcome. Donna Adams from Oklahoma City. Welcome, Oklahoma. Paula Van Valkenburg says, Paula, how are you doing from Washington? Botfly from the botfly larvae, and they grow inside the body, and it works its way out. Okay, we don't have those in the United Kingdom, so I'm not too familiar with that, but it sounds pretty gruesome. Donna Adams, how are the subscriber maps coming along? You keep pulling me on the subscriber maps, Donna. Soon I will have it. I promise you. It's in the pipeline. It's in the pipeline. Sulali, how are you doing? She's wishing Caroline Tom a very lovely day. It's Laura B3 from West Athlone in Ireland. Top of the day to you, Ireland. Jen Norbury, how are you doing? Mary Wolf, not in Amsterdam, live in Limburg, near Roermond. Wonderful. Limburg. Wonderful. Sandra Kaywood, Dr. K, it's Sandra Kaywood from Maryland. How are you doing? From the Naval Base. Wishing you well. Stay healthy, stay safe to you too as well, Sandra. Cynthia Scott, wishing everybody happy Friday. Any info on gallbladder stones, symptoms, etc.? Sherry. Yeah, next to the liver, and it's used to secrete bile that helps to kind of emulsify fat and digest anything that comes towards the liver. Now the problem is that it can get stones, they can get like congealed, and they develop, and it causes the gallbladder to go into spasm, and that is excruciatingly painful. It typically affects middle-aged women, yeah, and it can be exacerbated. That means it can get worse if you eat fatty foods. If you eat butters and sausages, then after you've had a heavy fatty meal, the gallbladder is working extra hard to produce the bile, and as it's doing that, it's going to go into a spasm, and that pain, I tell you, is absolutely excruciating. In fact, it can be so severe that you need morphine to reduce the pain. Now, how do we treat it? Most common cause is they whip out the gallbladder, a laparoscopectomy. So that is how we do the gallbladder. Marcia from the West Valley, Utah. Welcome, Ekstrom. Excuse me. Belinda, welcome from Cologne. Merchandise. How about reusable shopping bags with your face on it? No, I think that's gone too far. We've got to like, I think mugs and face masks, but nobody wants to take me to the supermarkets. It's a great idea, but yeah. And also we're kind of limited as to what we can do because Teespring, which is the YouTube partner that does all the merchandise, has a very limited product range, and it doesn't include reusable shopping bags. But it's got like key rings and mugs and iPhone covers and all this kind of stuff. The kind of stuff you'd expect maybe in a souvenir shop. Laura, I'm getting a hysterectomy procedure, for those who aren't aware, is to remove the uterus. And there are two forms. There's the old school version, which is what we call a total abdominal hysterectomy and bilateral salpingo-oophorectomy, which means they cut into the lower tummy and they take out the uterus, the tubes, and the ovaries. That's the old way of doing it. And it involves staying in hospital for several days as you recuperate. And then there's something called the LAVH, which is the laparoscopic. You remove the uterus laparoscopically, and then they draw it out through the vagina, through the cervix. So it's laparoscopic assisted vaginal hysterectomy, which is different to the total abdominal hysterectomy. So it depends what you're having. The laparoscopic assisted, much quicker recovery time. So you're in and out, I think, the same day. But still major surgery and takes weeks and weeks to recover. So, you know, you won't be able to do any bench pressing or anything like that. You have to rest up. Can take up to 6 weeks to fully recover. So I hope you are going to be fine, Laura. I hope that was useful. Let me know what kind. Are you having a total abdominal or are you having the laparoscopic assisted? Let me know. Jay, Margarita said, hi, doctor. Good work. The Portuguese all like you. Congratulations. Fantastic. It's good to hear. Obrigado, obrigado, obrigado. That's my Portuguese for Portugal. Wishing everybody in Portugal a wonderful time. I know that Portugal has just come off the quarantine list, so congratulations. They've come off the quarantine list, so that's great. I've just had Botox injection. That's Lisa Kelly. Wonderful. Okay, let me know how it goes. Marion says, Dr. Sadek, you'll be talking about diabetes again. If so, will it be type 1 or type 2? I think the most common is going to be type 2. I think that's what's really affecting everybody, developing diabetes as opposed to being born with diabetes. So we'll be covering type 2. Cindy S. from Toronto. She's enjoying the channel. Welcome. I did my elective in Toronto at the Sunnybrook Hospital in Toronto. Loved it. I was at the U of T. I was at Knox College in Toronto for a few months during the winter. Very cold, but lovely people, lovely city. Laura James from Windy, Kentucky. A. Pastrana is wishing everybody well. Louise Cook, I'd love a pair of scrubs. I'm a size small. I'd vote just for your name. Let the group decide. Wonderful. Bev Everett from Wisconsin. Welcome. Duchess Lynette from Chicago, Illinois. Sandra Goody from Enfield in England. Your scrubs are awesome. We sure want a pair. Blue, small, medium, all of it. Mary Hyder says welcome, and she's loving it. Peggy Harris from Indianapolis. Amy Tapscott from Florida. Question. I saw someone in a video snip off a skin tag with scissors the other day. Is that safe? Ooh. Well, skin tags are pretty benign. I've got a skin tag here. As long as it's anesthetized, you could pretty much snip off with a blade, a derma blade, a scalpel. Scalpels are designed for cutting tissue. Scissors are there for cutting bits of string. So yeah, you can technically do it with a sterile pair of scissors. Big AI, how you doing from Oklahoma? Big fan. Welcome, Big AI. And who else? Denise. I have Botox injections every 5 months. They're in conjunction with my CO2 laser treatment. I have cystic acne scars and have 2 treatments using CO2 laser to treat facial scars. Well, that's really good. That's really good to know. Let me know what the results are like. Send me some photos. Laurie Wallace. So what do you think of waving coffee cup? Yeah, I like it. I like it. I like it. The waving coffee cup. I will. I'll take some pictures and I'll put it on. I'll put it on. Linda, greetings. Linda Gaskill saying, hope you're well. Hip surgery in a month. Any suggestions? Take it easy. Don't expect too much. Make sure you get lots and lots of physio to make sure that your hips are jiving again so that they're nice and mobile. So definitely you'll need a bit of physio, but don't expect too much too soon. Take it slow. Let's see who else we got. Bruce Davis. Hi, Bruce. Welcome. Welcome. Big AI. By the way, I saw one of your videos and it prompted me to have this bump on my neck checked. They took it out today, looked like a shrimp and smelled. Thanks for getting it. Fantastic. That's brilliant news, Big AI. That is the best news today. You win the week, Big AI, because the videos are there to educate people, to say, look, if you've got a cyst, you've got a lipoma, it literally is 10 minutes max, 10 minutes maximum, and it's done. Local anesthetic, it's all done. It doesn't need to grow. It doesn't need to get infected. It doesn't need to cause you distress. It doesn't need to be psychologically draining. So absolutely, Big Eye, well done. A round of applause. Love the fact that the videos are reaching out to everybody. Remember to hit the like button. We're going to go to the premiere. We're going to see twin cysts with narration. And then on Sunday, we've got a great big whopping epidermoid here, full of content. It just comes out. And the guy, he'd stabbed it a couple of times himself before, so it was like really scarred and really difficult to get it out, but eventually we got there. So make sure you watch that. The coffee would spill, absolutely, if it was college. Large coffee cup says, Bridget. Tracy Reagan, I get spots under the skin. They never come out to the head. They really hurt, but she loves the videos. Okay, I'll probably do laser therapy on those. Rohab, caught you live. Awesome. Please post menopause acne. Okay. No, it's not your thing, but it'll help. Okay, I will do. I will do. Is that post-menopause with HRT or without HRT? Let me know. Cindy S, enjoying the procedures and the commentary. Thank you, Cindy. Sarita Foster, welcome. Never too late. Don't apologize. Happy to have you on board. Elsa Vieira, how are you doing? And Sandra Goodish, can't wait for Sunday. Absolutely cracking cyst. Mary Wolf, cup with a special Limsburg pie. Oh. I think we're going to be all invited for some Limsburg pie. What's in a Limsburg pie? Let me know. Bruce says, hi, doctor. So people with diabetes, do they get blackheads? Yeah, they can. They get an increased rate of skin infection. Yeah, absolutely. Help with HRT. Help with HRT. Okay, well, we'll cover that. Okay. Right. Everyone, we're going to go to the premiere. Remember to catch me on Sunday for a very big whopping epidermoid cyst. But in the next clip, we've got two cysts. Till next time, stay safe, everybody. Ciao. Bye-bye.